there's a comment that a fortified body can withstand the onset of disease more easily and improve one's natural healing abilities. So what are your tools to offer people to improve their natural defenses? I guess I'll go with Dr. Mensah first, because that's what Dr. Roy keeps doing. So I'll save for the cue.
You're catching on. One thing that I will say first is I read a lot of data about the microbiome. I think that's a huge popular term that's coming up in our medical fields, and also with patients who are Googling or trying to enhance their own health. The microbiome is just the city of organisms that live in our gut. And keeping in mind, most of our immune system lives inside of our gastrointestinal tract. And a lot of data shows the way that we're able to optimize and improve our microbiome health actually informs our immune system with how to be more effective and more deliberate in fighting disease and to healing our body.
Yeah, and I love that you just said that, and I would answer that question so differently. So I'm going to say yes to all that, and then I'm going to just say it a little more like step by step. So when a patient is referred to us by Dr. Lutz or any of our wonderful urologists, the first thing we do is we spend an hour and a half going over a complete history. An hour and a half is a long time with a doctor. So we get to know you really well. You get to know us really well. And what we're looking at is how you manage stress, what your coping mechanisms are, whether you have a history of anxiety and depression, or whether you just struggle with managing anger, managing mood. We look at how you eat, when you eat, what you eat. We look at whether you're having sex, whether you want to have sex, what's going on with erectile function. And we look at that in a detailed way. We look at how you sleep, what time you sleep, whether you wake up during the night, how often you pee, what goes on with your stream. So we're asking you a lot of invasive questions, but the goal is to get a very holistic, to use a buzz term, picture of what your life actually looks like as an individual man facing aging and aging well. Forget about prostate and prostate cancer, facing aging and aging well. Because as Dr. Lutz and I just said, prostate cancer is a disease of aging. It's not necessarily something that we should all be frightened about. It's about how we age, right? Once we take that history, we do a comprehensive workup on you. So that can include going back to urology for some tests. It can include some heart tests, like an EKG. It can include pulmonary function test. It depends on the person, but we definitely do blood work. And in that blood work, we look at metabolic markers. Metabolic markers are how your body is using the fat and sugar that you're consuming, how stress is managed in your body, and how it relates to the sugar that lives in your body. We look at risk predictors for heart disease. We look at hormonal health outside of testosterone. So, for example, your thyroid hormone, which helps your body to manage energy and fat and sugar. Once we have all of that data and we go over it with you in person, we develop a comprehensive plan in conjunction with whatever you're doing with urology. So let's say urology has a watch and wait approach. You're in active surveillance. They're seeing you for digital rectal rotating with MRI. Our job is to see you in conjunction with those visits and work on what we're seeing your metabolic picture to be, what we're seeing your stress picture to be, what your other risk factors are, and optimizing your health and tracking your PSA through urology to see if it's responding to those strategies. And not just your PSA, but your lipid profile, in particular your triglycerides, your HbA1c, which is a fancy way of looking at sugar over a 3-month period, all of those pieces. So it's a really exciting and a comprehensive approach to looking at prostate and men's health in general that has nothing that's almost it should be standard of care. We were just talking about this before we got started, and it's extraordinary to me to say that it's not, because you cannot separate out your health metabolically, cardiovascularly, sexually, and emotionally from prostate cancer or prostate.